Good evening. My name is Jane Allen, and I am the CEO of the Nashville Entrepreneur Center. I'm about 4 months in, and this is my first healthcare startup showcase, and I am so excited. So excited. Thank you, thank you, thank you. Yes. And I really want to thank our participants. It takes a lot of nerve, and you're entrepreneurs, and you believe, and it's exciting, and I cannot wait to watch you all present your companies and the solutions that you are providing to the healthcare community. I also want to thank Deanna and Sarah Cannon for this amazing space. Can we give a hand for that? Hello? Thank you. Thank you as well for being a trusted advisor and mentor and helper to me through this. And thanks all of you all for being here. We really do look at our Project Healthcare as our program that has been in existence since the beginning, which we are coming into our 10th year as the Nashville Entrepreneur Center. And we have had many companies come through, and of those, 77% are still in business today. That beats industry averages on startups and early stage companies. We have a significant impact, and it's because of many of the people in this room. People who are willing to give their time and their resources to help the next generation, who are willing to come in and work with them and help them solidify what their business problem or what the problem their business really solves. At the same time, we're looking to work closer with our healthcare community to make sure that the companies that we are actually selecting to come through Project Healthcare address some of the challenges and opportunities that your companies face. What are you looking to be forward-thinking, innovative when you look 3, 5, 7 years out? And so we actually have been working with the Nashville Healthcare Council, which I want to thank, and their fellows who have given us a lot of information about what are some of the things that we should be looking for in our next Project Healthcare cohort. At the same time, I've been able to meet with several healthcare companies, executives who are willing to give me their time, and also share insight into different types of companies they would like for us as the Nashville Entrepreneur Center to be looking for as we move forward together. So again, I really do appreciate everyone being here. Just a little bit, since it's our 10th anniversary and 10th year we're coming up, we've had, again, 73 companies. 50 of those are based here in Nashville. Again, 77% still survive. Over 488 jobs have been created, 133 million in capital raised, and 500 million and 50 million in revenue generated. Looking at this year's team, we started with, how many, Jeremy? 78 applicants. And so we go through a vetting process where we worked with others, and the fellows, we're going to try to get some of them to work as well as industry experts to help vet the companies and select them for the programs. And we started with 16 companies. Part of the process is vetting. And so 3 have been eliminated. And well, 3 are no longer here. Sorry. And then of the, I'm sort of blunt. Of the 13 that are, 9 were actually qualified to stand before you tonight. So again, we really do appreciate all of you. Since starting, all of them are growing revenue, which is a wonderful thing, and are really making progress. So with that, I'm going to turn it over to my friend and mentor, Deanna, and ask her to say a few words.
Perfect. Hi, everybody. Welcome to our house. And we are thrilled that you're here. I'll confess to you that I have a little PTSD about this event. And you're probably like, what does that mean? Did you get rejected or what? No, I kicked off this event last year at the CMAs. And so you kind of go, well, that's really cool, Deanna. That's a great space. No, this is Project Healthcare. This is not Project Music. And so I'm standing here kicking off, and on the front plate, it says CMA, and all the pictures about Project Healthcare were my kicking off Project Healthcare at the CMA Awards. So no more of that, Bobby. We're not having that. We are going to have healthcare supporting Project Healthcare in incredibly unique and powerful ways. So I'm working through the PTSD and just thrilled to have you guys here tonight. Just a couple of words before I introduce the real attraction for tonight beyond the pitches, Bobby Frist. But I want to tell you just a little bit about who's in this building. So I'm the CEO for Sarah Cannon. We're the Cancer Institute of HCA Healthcare. Two other subsidiaries are in this building, Health Trust Purchasing Group, a very large GPO, predominantly owned by HCA, and then a company called Parallon for revenue cycle and staffing and other types of shared services. But let me talk to you just briefly, just 2 seconds, Jane, about Sarah Cannon. So cancer is my passion. Serving patients at the most vulnerable time in their life is my very favorite thing to do. Some of my colleagues are here tonight, Angie Taylor, Lisa Morrissey, and others. So just so you know, and I won't ask you to raise your hand, but 1 out of 2 men and 1 out of 3 women will be diagnosed with cancer in their lifetime. And so you kind of look around the room and you go, wow, if it's not me, it's you. If it's not you, it might be me. And so those are really, really tough statistics. We think that there will be, by 2030, about 30 to 40 million cancer survivors. And cancer survivors are defined as those that are in active treatment or who are living with a cancer diagnosis. So it's really, really compelling. I have a research institute, so Sarah Cannon Research Institute, and then I run the cancer service line for HCA Healthcare, so all of the cancer operations across their very large footprint. But I think for all of us, understanding that access to novel therapies are so important in cancer. So if you're diagnosed with cancer, and again, won't make you raise your hand, you're looking for the latest and greatest. And my public service announcement for you tonight is if you or someone you love is diagnosed with cancer, go to an institution that conducts a significant amount of clinical research, because the field is moving so rapidly. You want to be with the providers who are on the cutting edge and understand the latest and greatest. So that's my little public service announcement for everybody in the room. So again, welcome. And I have the distinct privilege of introducing Bobby Frist, who's the CEO of HealthStream, and we're neighbors. He's right across the street. I have the great privilege of being on the Nashville Healthcare Council, and Bobby is the current chair for that. And you know how you're all really busy and you're like, you just don't need another meeting, and you don't need another board, and you don't need any more constraints on your time. But the Nashville Healthcare Council, if you don't know about it, is incredibly important in our city, with really the city and the region top healthcare leaders. But Bobby hosted us across the street, what was it, a month ago, 6 weeks ago, something, time flies. But it's one of those things where you're just like, I'm dreading this, right? I don't need this. I've got so much going on. Bobby was masterful in getting all of these incredibly talented CEOs to engage in what is the next iteration of healthcare in the city and in our region. And so it wasn't that bad. It was actually really good. Bobby's a fantastic leader. The other thing that I'm really, really grateful to Bobby about, not only is he one of the founders of the EC, but he has vision. Has real vision. And when you think about entrepreneurship in Nashville and in this region, what Bobby understands, and I know he'll talk about, is that how the Nashville Healthcare Council of established leadership, proven track record in healthcare leadership, how is it that we integrate with the Entrepreneur Center in order to do something really special and maybe something that no other city in the U.S. Is able to do. So I'm grateful for your vision, Bobby, around that and for what that will mean to Nashville in the future. So without further ado, Bobby Frist.
Okay, thank you for those kind words, and surely been a pleasure to work with you on the boards of Mini Pearl Cancer Foundation and other places as well. So it's been fantastic. But tonight is about the entrepreneurs. And one thing I can say after kind of crossing the chasm is you never cross the chasm. So I'm still running HealthStream, and every day you wake up with the same nervousness of growing your business, figuring out the next thing, and figuring out a path to maintaining success, whatever you've achieved. So for the entrepreneurs tonight, in many ways, this could be a starting night for you. You could end up getting capitalized tonight. But I will tell you, the same feelings that you have tonight of a little nervousness and trying to figure out your way and get your capital. I'm 20 years past getting that first round of seed capital, and I wake up the same sense of you need to get to work. You got to figure out what's next. You got to proceed and go forward. So it's never over. So first, real quick, let's have our entrepreneurs. Are they in the room now? They're all in the room. Just stand up, the cohort that will be speaking tonight. Just stand up real quick, because I want to give you some encouragement. So a couple things you should know is we're here for you. We want to see you succeed, because our economy, our country is based on the principles of innovators making things happen, making society better, and driving forward with great principles. So first thing you should know is we're pulling for you. There's no reason to be nervous, because everybody in here wants to see you do well. So do well. The second thing is, persistence is everything. So tonight is not the end of anything. It's not really even the beginning of anything. It's just another step, and there'll be another one tomorrow and another one tomorrow. And I think real entrepreneurs, it's a horrible, capitalism is a horrible vetting process. It just never stops to kick you in the butt and send you back into your chair and say, you're going to get up again, you're going to do it again. And so I just remember that it's part of Americana. It's stressful, it's hard, but we need you to succeed so that our country can still be strong, and we can have great entrepreneurs break through and change the world. So that's my speech to you guys. So thank you all, and good luck tonight. We look forward to hearing your pitches. Now, I guess this is for the whole group. So in the spirit of trying to find constant motivation and inspiration, I've been given a book about a year ago, a little book, and I've been buying copies of it lately, and I give it away. And it's a book of quotes. And so what I'm going to do is a quick challenge to you guys, and we're going to see how long it takes you to figure out who the book of quotes is from, and then whoever gets it. So you got to shoot your hand up when you think you know it, and we're going to see. But I think you'll find a little bit of inspiration in some of these quotes, because I do. I do. This is really a lot of fun. So here's the first quote. An optimist sees an opportunity in every calamity. A pessimist sees a calamity in every opportunity. You have a guess? Edison. That was going to be my guess, so it's a really good guess, but it is wrong. Capitalism at work here. Out of intense complexities, intense simplicities emerge. Like tonight, incredibly complicated night. You guys have been preparing for a long time. End of the day, you'll either get money or you won't. It's going to be simple. But it's very complicated to get to this point. So who wants to guess? Out of intense complexities, intense simplicities emerge. Steve Jobs, I love it. That sounds like Steve Jobs. I like it. It is not Steve Jobs. Yeah.
I guess right here.
Ben Franklin, another great guess. Not Ben Franklin. I love it. You guys are missing this. This is great. All right. The farther backward you can look, the farther forward you are likely to see. They get easier after this one. Another Einstein. Close. That very much sounds like Einstein, or it should be Einstein, but it is not. Bobby Frist. It could. I wish. No, that would be the ultimate compliment. So, okay, here we go. We're going to get a little closer. You're going to figure it out now. The inherent vice of capitalism is the unequal sharing of blessings. The inherent virtue of socialism is the equal sharing of miseries. Rand. It is not Rand, but that is a really good guess. Winston Churchill, we got a winner. Very good. Okay, you're going to get the book when we're done, so congratulations. And I think you'll probably get funded now, but you're one of the entrepreneurs, right? All right, good. You made the first vetting. All right, so I'm going to read two more just because I didn't know if you'd get there. It is the socialist idea that making profits is a vice. I consider the real vice is making losses. Here's your Winston Churchill book of quotes. Congratulations. So I connected with these entrepreneurs about 5 months ago. We hosted an event over at HealthStream just across the street. We got that initial kind of cohort together, and I don't know how long they'd been going at that point, but you could tell there was some energy in the room, and they were looking forward to getting to this point. I know that the process has matured the companies and the ideas. In fact, some of you I've met with offline and know that that is in fact the case. So I know we're all going to enjoy the pitches from these entrepreneurs. So tonight is an important night in capitalism, it's an important night in your lives, and I want to wish you well, and let's get on with the show. Good luck to all of you.
Love it. Yes, thank you so much to Deanna, Bobby, seriously, for hosting us, for hosting the teams like you did. We're incredibly grateful, and it's super important to the teams, as they will definitely tell you. So hello, everyone. My name is Jeremy Raley. I'm the program manager for Project Healthcare at the National Entrepreneur Center. So I get to work with these lovely folks on a year-round basis to make sure they're getting access to resources so that we can do this. We can fulfill our mission, which is to bring healthcare technology and business leaders together to nurture startups and entrepreneurs to build the future of healthcare. That's what we're all here to do, and that's hopefully what you guys are here to do and support. So thank you once again for being here. A little bit of information, just high level of how the program actually works. Once we onboard the teams, it's all about the 5 C's, which is connections, coaching to our wonderful mentors a lot here in this room, curriculum. We've been an institution for 10 years now, so we've amassed a lot of learnings along the way on the startup process, a community of other founders that are going to be in a similar stage that share that journey with you to help learn from their experiences, and access to capital connections. Some of you guys might be in this room tonight for that purpose, to kind of see who's the next and best in healthcare in Nashville. And I'll tell you a little bit about another way that we connect entrepreneurs to capital. Jane already went through some of these stats. I'll just leave it up there for a second so you can check it out again. Once again, this is that current cohort. And the beauty of working in this model is that a lot of times we're able to work with entrepreneurs that already have a little bit of traction, sometimes pilots, revenue. And so it's a lot easier to kind of implement them into a system where they're getting that coaching along the way once they're already going. And we've been at this for a long time and have supported a lot of great companies. A little bit of, so for one, thank you to all the sponsors that have made this event possible. Quick round of applause. Because truly, it's not just a financial contribution that makes these supporters what the program is worth. It's really in the connections to folks within their organizations for these teams. And so thank you so much to everyone. I know a lot of you guys are here in this room. And then also, the Entrepreneur Center is a 501c3 nonprofit. And so as that type of organization, we have a lot of partners that make what we do possible. So thank you. And I know some of you guys also are in this room tonight from this general list. So a little bit of context for where we're at in the program. Bobby alluded to it a little bit. So we offer the teams a spot in July, and then they have the first 6 months really of iterating, of getting feedback, of meeting with people like Bobby and institutions like our partners to then implement that into their products and make changes and tie together all into a really succinct story. And that's where we're here tonight, Startup Showcase. But most programs would end in a pitch night, but what we learned along the way was once you pitch, a lot of the entrepreneurs were kind of up to their own devices to make connections, whether that's investors or potential customers, to then actually close a deal. So what we do is we actually have one more time where all the entrepreneurs come in, and that day is April 23rd, so mark your calendars, where we have what we call an unconference. And you might be wondering, what the heck is that? Well, when you think about what the most valuable parts of a conference is, it's the potential connections to customers, investors, or partners Panels are great, but it's really about what are you going to get out of it. And so we flip it on its head and we invite all of those individuals to the Entrepreneur Center for one full day of connections between entrepreneurs and those customers, investors that they want. So if that sounds like you, just hold on, because at the end I'm going to have a really simple way for you guys to get that information and to engage in this and that process. But really these teams are here tonight to build momentum into unconference and to start those conversations to really generate real results, whether that be investment, pilots, or customers. Okay? So with that, I always do one more thing before these pitch nights, and those of you who've been with us might know that, but as you might think, a healthcare entrepreneur showcase might be a kind of golf clap sort of event. Oh, that was a nice pitch. But we like to have a lot of fun at the Entrepreneur Center, and these folks have worked really hard and are going to kind of wow you with their companies, and so we want to make sure that applause matches that level, and I can't just leave that up to chance, so we are going to do one practice round before we actually get to the entrepreneurs. So on the count of 3, we're going to act as if I just got done with the pitch, and I want to hear the biggest applause that you got to kind of warm up the vocal cords and get the body moving, okay? So 1, 2, 3, thank you. That's it. It's on the money. Okay, so without further ado, we're going to start with the pitches. We're going to go one by one right after the other, and it's my pleasure for the first one to introduce you to Sean Switzer of CareLoop from Colorado.
All right, thank you, Jeremy. And welcome, everyone, and thank you for joining us tonight. Again, I'm Sean Switzer with CareLoop, where our mission is simple: to reinvent the way that we communicate with patients and their families, and also care for them, to communicate and care for patients and their families throughout their journey. Recognizing that in doing so, we not only improve patient experience and drive better outcomes, but we can also give providers peace of mind without adding to their workload. Let me first start with a question. By show of hands, how many of you would feel comfortable boarding an airplane if each and every day there was at least one plane crash in this country? No? I didn't think so. That would change the way that we feel about the airline industry, would it not? I mean, a serious issue would need to be addressed. Well, anecdotally, that is exactly what's happening in the US healthcare system today. Over 250,000 deaths occur each year due to medical errors, the equivalent of a jumbo jet crashing every single day, and all of which are underpinned by breakdowns in communication and patients slipping through the cracks. And it's not hard to see why. Just look at all the disparate channels we use to deliver critical information in healthcare. We communicate with patients via back and forth phone calls, emails, woefully underutilized and archaic patient portal inboxes, and of course our primary channel, the 20-page discharge packet that we send patients and their families home with, and then we just hope. We hope that they retain everything that we've told them, and we hope that they know how to navigate the next steps on their own. Like many of you in this room, I've experienced this firsthand. After the birth of my son, my wife was taken into emergency surgery, where infection, severe blood loss, and septic shock led physicians to tell me that this photo would never be taken. They pointed me in the direction of a room and said that I needed to begin preparing myself for what life would look like raising my son alone. As you can see, my wife is a fighter and the care team rock stars, but after nearly a week in the ICU, we were sent home with nothing more than that same discharge packet of boilerplate content. No check-in, no call, no additional information. We all have those stories. So recognizing that we can't stop care and communication for patients and their families the moment that they walk out the door, while also understanding we can't continue to add burden to our care teams, CareLoop is a modern-day, simple, intuitive communication channel that brings the person and their family caregivers to the center. We bring in relevant data from the electronic health record and then automate messages and check-ins to help guide them on their journey. For the care team, we're seamlessly integrated into the EHR and patient chart. If a flagged message to a clinical pathway is received, the appropriate care team member can be notified, allowing them to initiate their already established workflows and protocols. The CareLoop system is built and implemented in several clinical settings. We've developed strategic partnerships with organizations that lead the industry in their respective areas. And we're currently in conversations with large provider groups who are looking to build out and scale their discharge service lines in alignment with the new payment and alternative reimbursement models that are on the horizon. As more hospitals and health systems take on risk in this value-based care environment, tools like CareLoop will be critical to maintaining and improving the care that they provide at a fraction of the cost. Our competition includes all of the disparate channels that we already use today for communication, like patient portals and patient engagement applications. But unlike CareLoop, these solutions require significant attention and work by providers and teams that are already stretched to their limits. This is the driving force behind why they're all so underutilized. And we developed the team to tackle and solve these problems together, led by our founder, Dr. Foster Goss, a practicing ER physician and Harvard-trained bioclinical informaticist, and our CEO, Carla Gallegos, a veteran of healthcare technology who's worked for organizations like Kaiser, Allscripts, and Cisco. We've developed a leading-edge platform that will transform care and follow-up for our partners. So if you would like to learn more about the important work that we're doing at CareLoop and how you can be involved, we would welcome the opportunity to schedule time with you and your teams for a more in-depth review. Thank you for your time.
Hello, everybody. I'm Haley Combs, and I'm a program lead here at the Nashville Entrepreneur Center, and I have the honor of introducing the teams along with Jeremy tonight. So for our next team, I'm very excited to introduce you to Felicia Jackson of CPR Rep, and she's coming from Chattanooga, Tennessee.
Hello, my name is Felicia Jackson, and I am the inventor and CEO of CPR Rep. This is my son, Markel. When he was 2, I almost lost my baby to a choking incident. I was working in the medical field and CPR certified, but instead of doing what I was trained to do, I froze. Thankfully, my husband was there, and he was able to save our son. This is our son today. A thriving 19-year-old, but we are aware that his story could have ended in tragedy. According to the American Heart Association, more than 350,000 out-of-hospital cardiac arrests occur in the United States every year, with 240,000 of those happening in the home. The person most likely to respond to that emergency will be you. It has been proven that CPR provided immediately after cardiac arrest could double or even triple a victim's chances of survival. But 80% of Americans are reluctant to perform CPR due to a lack of knowledge or fear of causing harm. With a show of hands, how many of you would feel confident that a bystander would be able to perform CPR on you or a loved one if needed? This is why I invented CPR Rep. Our patented disposable CPR template protects and guides the non-medical responder during CPR. CPR Rep has an attached one-way valve mouth barrier for rescue breathing, visual hand placements for proper compressions, and simple instructions that can be translated into any language. They come in adult, child, and infant sizes with a price point of $14.99. Our competitors are the makers of battery-operated and pneumatic-driven machines like the Zoll Pocket CPR or the AutoPulse. These devices either require certification to use, they're costly, or they can only be used on victims 8 years and older. The CPR medical device industry is a $2 billion market, which includes 132,000 schools, 6,000 hospitals, and 6,500 medical device distributors. We have partnered with Walmart, the U.S. Department of Energy, CHI Memorial Hospital, Hamilton County School Systems, and many more. We have already started to sell into this billion-dollar market opportunity by focusing on the thousands of CPR training facilities. Now, each facility will provide a CPR rep to each student upon completion of training. To date, we have signed up 6 US-based CPR training facilities and 1 facility in South Africa. On average, each facility can train over 50,000 students a year. That's a revenue of $450,000 for one site alone for us. We are asking for companies to partner with us to increase their health and safety protocol and community awareness. For example, provide a CPR wrap to a new mother or a cardiac patient before discharging the hospital, or to a police officer or new cadets to put in their emergency bags. A CPR wrap belongs in every classroom, on every airplane, next to every 3.2 million AEDs, and inside of every 2 million first aid kits sold every year. We are on a mission to empower people everywhere to step up and do the most basic, unselfish thing a human can do: save a life. We welcome you to visit us at cprwrap.com to get your wrap today to save a life tomorrow. Thank you.
Powerful stuff. Thank you, Felicia. Up next, it's my pleasure to introduce you, all the way from Portland, Oregon, is Brian Forrester of Midas Health.
Thank you. Hello. My name is Brian Forrester, and like Jeremy said, I'm from Portland, Oregon. As America's need for healthcare continues to rise, 93% of hospitals report a shortage of clinical workers. That includes doctors, nurses, technicians, and others. What this means is that employers are competing more fiercely than ever for the talent that does exist. I don't know if my clicker works. It's frozen. It's okay. I don't need it. I need it. There we go. Okay. What this means is that employers are competing fiercely for talent, spending more money than they ever have before on sites like Indeed, ZipRecruiter, LinkedIn, Monster.com, and others. Those same companies in 2019 reported earnings that broke all records. As you guys, as healthcare sits here in pain, these companies are making more money. They're happy, they're stoked, they're making more money than ever before. The only problem with that is that traditional job ads, they're just not effective. And what should be on the screen is this. Okay, so here's an example of a traditional job ad, right? It's just words on a screen. It's been the same thing since 1996. At Midas Health, and this is effective at informing, but it fails to inspire, right? And in today's market, what you really need to do is you need to reach candidates, you need to inform them, but most importantly, you need to inspire them to come and work for you. And at Midas Health, we're creating a new standard. Point it that way? Okay. At Midas Health, our technology converts traditional job descriptions into what we call video job descriptions. And not only are they fast to produce, and not only are they affordable, but they're extremely effective. In an early case study, one of our customers compared our videos to the methods they had been using, traditional methods like LinkedIn and Indeed. And we generated a 500% increase in candidate engagement. And that's not it. We also generated a 5,000% increase in reach. I think I turned it off. All right, okay, we're good. I swear I know how to run a tech company, just not this. Okay. Some of our early paying customers includes brands that you might recognize, like AMN Healthcare, the largest healthcare staffing company in the world, and Banfield Pet Hospital, a veterinary company with more than 800 clinics throughout the country. My co-founder and I both have experience starting and growing other technology companies, and members of our advisory board represent companies like HealthStream, StrataSen, AMN Healthcare, and others, people who are mentoring us and providing guidance into the industry. We're here today because we just closed a friends and family round, and we're looking for early adopters and strategic partners. Does anybody here work for a company that's hiring? Anybody at all? You have any jobs at your companies? Okay, well that's great, because if you text this number, it's 31996. You text Midas to 31996, and we will produce for you a video job description for your company. So I'm going to leave this up here just for a second, but that's it, I'm done. Brian Forrester with Midas Health. Thank you very much.
All right, next up we have Kirkland Brooks coming from Savannah, Georgia, to tell us about his company, Febris.
Hello everybody, my name is Kirk Brooks, and hopefully this goes a little more smoothly. Febris is here to help build stronger nursing teams and lower onboard nurse education costs. The US healthcare system is currently facing a nursing crisis. It costs between $47,000 and $85,000 to onboard and educate a single nurse. We're about to be facing a million nurse shortage, and with an annual turnover of about 20%, even small hospitals are having to spend millions on this issue every year. Our solution is an easy-to-use virtual reality-based experiential learning system where nurses can learn by doing. This includes our testing and training modules, a management portal, as well as an API to tie into your current enterprise system. Healthcare systems have prioritized nurse education reform, some of them. HCA has even gone as far as to buy a nursing school. Virtual reality is finally accepted as a viable training medium. It's already being used in the medical industry for surgical simulators. It's also being used to help treat chronic patients, as well as speed up the recovery of stroke victims. It's also being used in law enforcement and by firefighters. It's trained thousands of police officers on situational awareness and how to deal with those situations, all within the safety of a simulation. And with the advancements in technology, you can set up a simulation lab for under $2,000. The annual market size for onboard nurse education in the United States alone is between $7.8 and $14.1 billion. And our main competition, sorry Bobby, you made this slide, is actually mostly hospital systems and how they've always conducted their training. That's classroom-style learning, on-the-job training, which has the potential to put patients at risk, as well as mannequin-style simulation labs, which can require a considerable amount of space and cost. Some other competitors focus primarily on lecture-style learning, and some have actually gamified some of our learning. Have gamified some of their learning, which helps information retention, however, has led to some students cheating. The good news is, with experiential learning, you retain 15 times the amount of information you do from lecture-style learning, and nearly 4 times as much as audio-visual style learning, all while effectively negating the ability to cheat. We're using a modified SaaS model that includes a hardware lease so that we can ensure uniformity of the hardware to speed up development, ensure safety and quality of our simulation, as well as some of our own authentication practices. Our modules are based on the package provided, and we also have a fee-for-value video storage of testing data. My name is Kirk Brooks. I'm an engineer, and I've been working with virtual reality for a number of years now. Ann McLaughlin is a nurse educator, and Drew Elrod's an MBA and has been working in the medical industry for a number of years now. We're very excited to have Atrium Health, a large healthcare provider between Georgia and North Carolina, as one of our pilot locations, as well as Catawba College's nursing program. We're currently raising $1 million seed round to help build on our marketing and sales, as well as bringing on some developers to help build out some more modules. I believe this Benjamin Franklin quote really exemplifies what we're trying to do here at Febris. It's tell me and I forget. Teach me, and I may remember. Involve me, and I learn. And I believe that's why we're going to have a large impact on this market. Thank you very much. Do you want me to use my clicker?
All right, next up we have Mohammed Mehmed joining us from San Diego, and he's going to tell us about his company, Hyphenite.
Thank you, Haley. Hello, I'm Mohammed Memon, CEO and co-founder of Untitled Health. This thing is ahead of me. Okay. America is getting older. We are spending more money on chronic care patients than ever before. Costs are rising. CMS is aware. Now they are offering CPT code reimbursements for chronic care management, remote patient monitoring, and telemedicine. The problem is less than 5% of the providers use these codes. In addition, we have a low medication adherence problem. Less than 40% adherence rates cost us about $350 billion as a nation. So what does our solution look like? It's called HiCare. It's a full stack, HIPAA compliant, cloud-based solution offered as a SaaS arrangement. We have two products, HiCare Chronic Disease Management System and HiCare Consult, a telemedicine solution. So HiCare is built from reusable stack of modules. We have connectivity to 50 plus medical devices and wearables. We have integrated through Redox a slew of EMR solutions and labs. We have connectivity and arrangement with pharmacies and claims. In addition, we have a very robust patient engagement, communication, and education library. Here's a list of all the CMS reimbursement codes. It ranges from $43 per patient per month to $144. Using our system, we can generate an additional $150,000 per physician per year in any hospital or clinic. Our target clients are providers. We have deployed our solution with hospitals in Arizona, Texas, and Minnesota. State of Minnesota approached us and offered us a platform, a pilot, to take our product and help them reduce their $4 billion medication adherence problem. In addition, we have also launched our product in China, just waiting on coronavirus to fade away. Our competition is Vivify, CareClicks, Philips, and so forth. Where they are not is where we are at. We are a full stack solution and none of them are. So we provide the best bang for the buck and offer the best, lowest cost of ownership. Our value proposition is we want to walk in with a turnkey solution. We have a partnership with the CMO where we take our solution and their army of nurses, walk into a clinic, get a list of patients, go take care of them for a month, and at the end of the month, show up with a check to you as a provider. What's not to like in that solution? Our price to our partners is $3 to $19 per patient per month. We are targeting no more than 10% of our revenues from our partners. Market opportunity is substantial. Total addressable market is $80 billion. That's the earmark number from CMS for 2020. Like I said, because of very low utilization, all those dollars are sitting there. Market is growing at a 21% per year with a serviceable, obtainable market of $2 billion. Market conditions are ideal. Market is in early stages. CMS is now reimbursing. Industry is fragmented, so there's not going to be a Google or Facebook who's going to come in and take everything over. There's a lot of room for a lot of players. Our financial projections for this year in 2020, we are targeting about $1 million in revenue and hope to be at a $28 million in 2023 with about a 50% EBITDA. Our funding requirements, we are trying to raise $2 million to continue our development and spend that money on sales and marketing to grow our business. We have built a very robust team. We have come a long way with very little capital. The market is perfect right now, and our products are ready. So we're just trying to scale up from here. It's my contact information. Would love to talk to you after this. Thank you. 4 minutes. So they are pressing.
All right, next up we have Kirsten Van Der Sluis, who's the founder of MCharts, and he's joining us from Denver, Colorado.
Hi, everybody. My name is Kirsten Van Der Sluis. I'm the founder of MCharts. We develop a personal health record application that collects records from all of your providers, gets it in one place for better understanding and cost savings in healthcare. A knowledgeable patient is much easier to treat. It leads to lower costs and improved outcomes. It reduces hospital readmissions. There are fewer medical errors. And we heard earlier from Sean, there's 250,000 deaths caused by medical errors every year. And this knowledgeable patient also reduces communication problems between providers. The bottom line is that helping patients to understand their conditions and their care plans is going to save money and provide better outcomes. Not everybody knows, but patients have an absolute right to their data. Everybody in this room has a right to your health data. HIPAA guarantees this right. There are new proposed rules that reinforce those rights and also provide the right to access that data electronically. And that means as a patient, you'll be able to select an application which will then retrieve your data for you. Seema Verma is the administrator for CMS. She says that every American should have access to their health care. She's fully behind this initiative. The solution is MCharts. Again, MCharts collects all of your records from all of your providers and then shows the information on easy to understand views, like the human body map and the Facebook-like timeline. The market is expanding dramatically. Currently, 10% of US adults have a personal health record application. That's expected to skyrocket to 70% over the next 4 to 5 years. That's 150 million new users that will be adopting a PHR, and MCharts plans to capture a large proportion of that user growth. We do have traction today. We have actually 650 users on the platform. We have our first paid subscribers, and we have our first commercial client in the healthcare industry. We also have 2 patents pending on the technology. MCharts connects into the EHR, and it does that through the patient portal. You can see some of the EHRs that are supported. But that gives us the medical aspect of your health. Health is much more than that. So we hook into Apple Health to pull in sleep, nutrition, fitness, and other parameters of health. We also can manually update information. And then finally, we can set goals that are relative to those measurements and help the patient track towards managing those goals and achieving those goals. The go-to-market strategy is initially focused on consumers. There we can rapidly gain adoption and also establish connections to providers. Longer term, we feel like the majority of users will ultimately come from partnerships to providers, payers, and health services networks. The business model for consumers is subscription-based. So a consumer will pay a subscription monthly of $5 for a family of 4, or $10 or $30 for larger, more feature-rich plans. For our partner channels, it's actually the exact same product, and we generally sell at wholesale prices. And these can be offset by reimbursables as well for things like a chronic care management program that Mohammed talked about earlier. There are other personal health record applications out there. MCharts differentiates by our ease of understandability, primarily using the human body map as the point of navigation, and also the immediacy of data. So we can connect immediately through the patient portal to download the data. We have a great leadership team that's executing on this vision today. We also have a great advisory that's filled with physicians, PAs. We have a PT in there as well, and digital health leaders. They're helping us refine our vision and execute towards that. Financial projections show us growing to $10 million annual revenue run rate in year 4, and we expect to be profitable in year 3. We are seeking an investment round of $500,000. This will give us a runway of 12 to 18 months that'll help us develop and go to market with this chronic care management program and other verticals. We'll attain 50,000 users in that time frame, and we'll be positioned for a Series A round. So in the end, I started MCharts just to help people collect their records, but what we ended up with is something much more than that. It's a platform that really lets patients own their records for the first time. They gain a better understanding of their conditions and their care plans, and they're actually better patients in conjunction with their physicians or their clinicians. We let them set actionable goals and drive towards those goals. And finally, for the first time, there's a tool to help people really advocate for themselves, their children, and their elderly parents. Thank you very much. I'd love to see you over at the booth. I'll give you a quick demo, and we can talk about potentially rolling MCharts out to your patient population. Thank you very much.
All right, our next founder is from Atlanta, Georgia. Please welcome Scott Cadora to the stage.
Hi, I'm Scott Cadora. We're with Medicare Pathfinder, and we use data science to optimize senior health care. So there are over 5,200 community hospitals in the United States, and 45% of their expenses come from treating Medicare patients. The problem is that the average hospital loses $17.5 million treating those same patients. They actually lose 10 cents on the dollar, but if you actually dig deeper into the data, 75% of those hospitals are actually losing 18 cents on the dollar. Part of this is structural. Medicare traditionally pays below market rates, but 80% of your senior patients actually have the wrong Medicare coverage, and that flows through to the providers. More importantly, healthcare providers are at a distinct disadvantage in their data science capabilities, especially compared to insurers. The insurers have much better data science capabilities, and you can see this in the data. They make a profit of $1,600 per patient per year, whereas the providers are losing $1,500 per patient per year. That's a $24 billion profit for insurers and a $92 billion loss for healthcare providers. Our solution is a comprehensive data analytics platform for healthcare providers to manage and optimize their Medicare operations. It's not a coding app. It's a data science platform that analyzes each individual patient to understand their likely healthcare needs, what their coverage is, and how the dollars flow to the provider, so that you understand the key factors that impact your operations' profitability and what changes in the marketplace will impact your operations and your profitability and your ability to care for patients. In a sense, we're connecting the dots between the patient's coverage, their likely health needs, and the cash flow to the provider. That's particularly important because if you want to understand how to improve your operations in Medicare, you first have to understand your patients, you have to understand their coverage, and you have to understand how that's going to affect value-based care programs you're going to consider, or if you're doing a contract with Medicare Advantage insurer, you need to understand how that directly impacts each individual patient that has that coverage. So our value proposition is this. We've identified $1,098 that the average hospital is leaving on the table with their Medicare patients. For the average hospital, that's a $12.5 million that they're leaving on the table that we can help them recover. We have a revenue sharing model, so we get paid for performance, and it's especially important where hospitals have minimal budgets for additional programs. We pay for ourselves. We also have a SaaS option for large programs. Our team is a dedicated group of data scientists, developers, and engineers from the likes of Apple, Duke University, Intel, Scout Mob, and Microsoft. And our advisors are clinicians that have operated hospitals, data scientists from Harvard, patient advocates, and insurance experts. So the traditional model of actuarials is both static and it's expensive. This is a dynamic market and it's getting more so. So if you want to be able to adjust, you need to have a system that can understand the changes in the marketplace and how that's going to directly impact your profitability. This is the largest patient group for most hospitals. It is the biggest impact on profitability and on cash flow. And Medicare is going to grow by 30% over the next decade. In addition, the value-based care programs and Medicare Advantage are having a much bigger impact, Right now, Medicare Advantage is 35% of the market, but it's going to 50%. In some cases, it's already at 60% of the marketplace. So if you don't have a strategy to incorporate data science into your program now, you're behind the curve because the insurers absolutely have this capability. So we're not only with the Project Healthcare, we're with Georgia Tech's Advanced Technology Development Center. We won a startup award at Health Data Palooza. We were featured in HHS's Healthcare Innovation Showcase. We are also running a pilot right now with Augusta University Medical Center, and we're launching a new pilot with a larger company here in Nashville. I'll leave you with this. Harvard Business Review did an analysis of this exact issue. How do hospitals make money on healthcare? And the issue is not data. The issue is focus and understanding how they can use data analytics to improve their profitability. That's what we've developed. We'd love to talk to you about it. Thank you very much.
All right, next up we have Omni. You'll be hearing from a founder, Sean O'Brien, all right, from Atlanta, Georgia.
You can keep the mic. I think I've got my own. Are we on? Awesome. Thank you, Haley. I'm Sean O'Brien. I'm a co-founder for a company called Omni. We're based in Atlanta, Georgia. So let's talk about a spend that will blow most of your minds. $250 billion a year is spent by life sciences and pharmaceutical companies on a limited set of healthcare data farmed mostly from claims. This data is incredibly wide, covers a lot of patient lives, but it's very, very shallow. It has high breadth, but it has very low precision. So this makes solving the toughest life sciences challenges around real-world evidence and patient journeys very difficult. Trying to map a journey out of claims data is disconnected, it's very costly, and most importantly, it's very imprecise. So the current approach is lengthy, and it involves a lot of guessing, and with the health problems we're trying to solve, we can't be guessing. So not anymore. Omni enables access to real-world evidence from our nation's best healthcare providers. Of that $250 billion spend, do you know how much our nation's healthcare systems are getting out of it? Almost nothing. It's mostly coming from claims data brokers. But we provide real-world evidence from our best care providers at scale. And it's deep, it's precise, and it's granular. So now, if you're trying to solve a real-world use case, you can get precise and near real-time data from the source. So from visit to lab, admission, discharge, and follow-up, life sciences companies can better understand patient care journeys. The current approach just isn't working. It's lengthy, it involves a ton of data reconciliation and guessing. Well, how do we get this data? Well, we partner with the source. Omni partners directly with health systems, and we create a compliant alternative revenue stream using our patent-pending marketplace. And we get data for all patient encounters across therapeutic areas and across all products. So the ED, inpatient care, ICU, and some of our country's best outpatient facilities. And because we're sharing the revenue back to the people actually doing the work, we're amassing a ton of data. We have 370 facilities. We have 50 hospitals, including inpatient and outpatient. And as I stand here on this stage, we have 3.3 million lives covered on our marketplace. And we package this in a product that includes our marketplace, which is self-service, on-demand, and searchable. So life sciences companies no longer have to go through a long sales cycle with data brokers like IQVIA. We can also give them just raw data, which allows them to power internal AI and data science initiatives. Or they can use our pre-built dashboards and our analytics packages. So I talked a little bit about our competitors. You'll recognize a lot of them: Optum, IQVIA, Health Verity. They're all making a ton of money, mostly off claims data. And that spend is about $250 billion. We think there's about another $250 billion waiting to be spent on accurate, deep insights that are near real-time and productized. So we have a lot of work to do this year. Like I said, we have 3 million lives on our marketplace, but by the end of the year, we want 20 million patient lives on our marketplace. We want to grow our health system base, mostly by geography. In order to do that, we have to expand our health system sales staff and our support staff. On the other side, we want to grow our pharmaceutical and life sciences revenue to about 2.4 million for 2020. And we want to develop an approach that allows our marketplace to scale so we can move more money back to the health systems. In order to do that, we have to build a world-class pharma sales team. So to that end, we're doing a Series A in the next 60 to 90 days. We're looking to raise between $10 and $12 million. And that's to fuel sales, product, ops, compliance, and all the areas that are critical for growth. In case you guys, this is dead. But anyway, we have a seasoned leadership team. As I said, I'm Sean O'Brien. I'm the CTO. I run engineering for Omni. My co-founders are Dr. Mitesh Rao, who is the Chief Patient Safety Officer for Stanford Medical. And my other co-founder is Sunny Gurwal, who led business developments for the genomics company Helix. And I'd love for you to come talk to me and talk a little bit more about Omni and have a great evening. I appreciate it.
This is our last pitch of the night, and he's from right here in town, Nashville, Tennessee. Please welcome Bill Martin, co-founder of Shepherd, to this stage.
Thanks, Haley. I am Bill Martin. I am co-founder and CEO of Shepherd. Shepherd is a mobile health platform that helps families manage the care of their aging loved ones. Thanks to modern medicine, we're all living longer, but as we age, our health continues to decline. This older, frailer population is getting much larger. There soon will be 65 million Americans age 65 and over, and 70% of these will need ongoing care at some point in their lives. Unfortunately, gaps have emerged in America's healthcare continuum. There are not enough, nor will there be enough, professional caregivers or affordable senior care communities to fill these gaps. Someone must manage the care of those who can no longer manage it for themselves. Ultimately, that responsibility falls back on our families, most often on the adult daughter, who typically already has a husband, children to raise, a job, and other responsibilities. Then she becomes one of 45 million unpaid caregivers for whom managing care is a critical problem because she doesn't have the tools or the resources or the knowledge or the time to do it effectively. She needs help. Shepherd was created for her. Shepherd is a curated experience that helps family caregivers manage the care of their aging loved ones. By helping a family caregiver assemble a care team of family, friends, and medical, legal, and financial advisors. By helping her assemble essential documents and records in a virtual lockbox. They are available to her whenever and wherever she needs them. Shepherd has a mission control center called the Care Hub that our family caregiver uses to make decisions with her care team, to schedule appointments, and to assign tasks. Vital Stats interfaces with IoT devices so that she's always aware of the health status of her parent. And Shepherd's Resources module keeps her up to date with current relevant medical information, including an interactive Medicare guide. There is an unmet demand in the market. 3 out of 4 family caregivers want to use technology to help manage care, to keep their lives intact, to give them more freedom, to keep themselves healthy, but only 7% have actually found anything that even partially does the job. The mobile health market is enormous. It was estimated at $28 billion in 2018 and will reach $102 billion by 2023. Shepherd is software as a service with monthly recurring revenue. We are projecting 250,000 users by the end of year 5. That is just 1/2 of 1% of the addressable market, but $150 million in total revenue. So as you can see, we have a lot of room to grow the company. Shepherd is a consumer application that aggregates first-hand consumer data for business. Therefore, our marketing plan includes both direct-to-consumer and channel partner strategies. For example, we will market Shepherd as an employee benefit. Employers lose over $2,000 in productivity each year for every employee who is also a family caregiver. We can substantially reduce that loss. We have competitors, but there is no leader in this huge market of 45 million non-consumers who have not yet found an adequate solution. We are currently raising a seed round of $500,000. If you have an interest, I'm happy to talk with you or talk to my partner, Rick Wiseman, after this. Thank you very much for your attention.
Let's keep it going. One more round of applause for all the teams. Woo! Also, an additional round of applause because tech does what tech does sometimes, and the clicker was not working. So one more round of applause to the teams for doing it under pressure, under circumstances. It's kind of like entrepreneurship, to where you have a plan and then something always happens and you got to adjust, and you guys did a beautiful job. It was my pleasure to be your guys' personal clicker from the backstage. Now I get the honor. So a quick thank you to two people who have been very instrumental in the process getting some of the teams here. One is Bill Brown. Where's Bill at? Over here. Thank you, Bill. He was one of our healthcare expert advisors that helped give feedback on pitches and pulled in some other folks. So Bill, thank you so much. So instrumental. And we love you. And the other is the National Healthcare Council, but specifically Mr. David Grider has been instrumental in helping get feedback, meeting with teams, and helping us make connections. So just thank you guys so much. And it's just a small snapshot of all the different supporters that we have, but thank you guys. So alluding to Jane's comment and the support of the National Healthcare Council, we were able to do a survey with all of their fellows, which is not just providers, but payers, government officials, investors, a host of people, and also work with our own partners, as Jane mentioned, to create a list of both problems and opportunities that we see in the national healthcare market. Now, I see you guys taking some pictures, and it's quite okay, because, just one second, but we are essentially creating this list because we are looking for solutions to some of these issues. And the beautiful part is that the individuals that are helping give these answers are wanting to engage with the startups. And that's really what we're trying to take Project Healthcare to the next level. And so if you are already solving one of these problems, if you know someone that's solving them, or hey, maybe you're an entrepreneur that is looking for your next solution or your next problem to solve, it could be right here on this list. So in tandem, I want to announce that the 2020 applications for Project Healthcare are now live, and you can either go to this website to get that information, or you can just text healthcare to 33777, and what they'll actually do is trigger an email that will give you that PDF download with those answers to what is the opportunities in Nashville healthcare right now, and it will give you a link to the applications amongst, if you potentially want to mentor or to engage or to support Project Healthcare in any way, that email will be what you will need to do. So a really simple message. The one thing I want to do before I break is there's actually a couple other teams that are here at the Startup Village that actually didn't pitch tonight. One is Tolerance 360, Sabrata. He's in the current cohort right now. You can learn all about his company. Yeah, Sabrata. And there's actually two teams that are in Project Healthcare Launch, which is a little bit earlier stage kind of foundational program within Project Healthcare that helps it helps support those that are trying to get into a project healthcare level program. And so we actually have Dr. Peter Litchfield of Provide is somewhere here. I see him kind of hiding right there. And Victor Brown of Excellent Life. And so they're also over here at the Startup Village. And so now it's the fun part. It's the part that you came here for. Time to connect and figure out how you can support these teams. So I'll ask teams to head to your tables. But thank you guys so much for coming. Have fun. Get a drink, get a snack, and make sure you text that number if you want to get engaged. Thank you guys.